next at 6.
When we think of preventing heart attacks and strokes, we often think of reducing our cholesterol level.
But that's not the only area of concern. There may be something else that can put all of us at risk. Dr. Jay Adlersberg is here with more. Jay?
Saturday, Diana, Americans are doing a good job of reducing their blood cholesterol, but there's another risk factor for strokes and heart attacks separate from cholesterol called triglycerides. A recent report says the number of Americans whose levels of triglycerides are too high has doubled in the last 30 years.
So how are you doing today?
Clarice Woods didn't worry about heart disease. There was none in her family. But Clarice's blood was loaded with triglycerides, a type of fat that responds to cutting down fatty foods in the diet.
I'm a beef lover. So I changed a lot to fish and vegetables, chicken, turkey.
Why should Clarice change what she eats? Because triglyceride fats in the blood are directly related to an increased risk of strokes and heart attacks, even when cholesterol levels are normal.
It turns out that only about 1/4 of people who have premature heart attacks have elevated LDL bad cholesterol. And in fact, if you look at people admitted to the hospital with heart attacks, it turns out that many of them have normal cholesterol levels.
Normal triglyceride levels in the blood would be a number of 150, but heart disease risk starts at 80 to 90 in women and in men at 120 to 130.
So triglycerides by themselves may increase your risk of heart attack and stroke. Is there anything you can do about it?
You can do as Miss Woods did. Reduce fat in the diet. Cut down on red meats. Eat more fish and chicken. Eat more vegetables. Cut down on starches in your diet, the bread and rice and pasta. What pills do you take? Oral contraceptives and hormone replacement therapy contain estrogens, which can raise triglycerides. So estrogens are a reversible cause.
If triglycerides are elevated, it's very important to start thinking about what the possible reversible causes are before moving on to medications that treat elevated triglycerides.
There are several medications that will bring down high levels of these bad fats, but why take them if you can simply stop drugs which push the levels up or change your eating habits? On that new diet, Miss Woods dropped her triglycerides to normal from a high of over 500.
Wow. Good for her. Yeah, good for her. Thank you, Jay. Thanks.